Hello everyone, this is Raymond Lee of Raymond's Dental Solutions. More than 75% of dental patients go to the dentist with anxieties and fears. This means when healthcare professionals provide a wow experience to each of their patients through exceptional treatments and services, there will be a greater chance for a dental practice of receiving positive feedback from their patients than the practices that belong to other fields. So, if providing this wow experience is the key to dental management, what kind of person should a dentist be to the patients, rather than thinking of patients merely as the recipient of oral health care? The dentist must treat patients as if they were close friends or family members. This outlook leads to living healthier and happier lives with a deep interest and affection for patients themselves. While caring for patients in such a way, the dentist must not forget that their services and offer of friendship will one day be reciprocated by their patients as well. Now, let's take a look at this more closely with a specific case.
A middle-aged couple visits a dentist, Dr. Kelly's, office. They are Pastor Tim and his wife, Naomi. Pastor Tim is serving as the senior pastor of a small church in a town not far from Dr. Kelly's office.
Good morning. How are you?
Good morning, doctor.
What can I do for you?
For the past few months, my husband has been suffering from having pain and swelling in his gums, and he's been taking painkillers. Last night, despite taking those pills, he was in so much pain that both he and I barely slept all night. I insisted that he needed to come and see you.
Okay, let's see what's going on. Can you open your mouth a little bit wider, Pastor Tim? Thank you.
After checking his mouth, Dr. Kelly found some of the molars have already been in a gum recession.
This doesn't look good. We'll have to check some more with a CBCT imaging. Pastor Tim, could you go with my assistant Olivia? She will guide you through CBCT.
In the meantime, Dr. Kelly asked Naomi,
Naomi, was there anything that's been particularly stressful to Pastor Tim recently?
Tim suffers from extreme stress because the senior elder, the leading elder in the church, passed away 6 months ago, and there has been a conflict among the remaining elders. In addition, the church's finances are not too great, so Tim's been worrying about that as well. It's no wonder he's under so much stress.
Oh no, that must have been really terrible for him.
After a few minutes, Dr. Kelly looks at the CBCT results, and he turns the monitor to his patient.
As you can see, there are black areas below the gum. This is periodontitis, which is the inflammation of the tissue around teeth, often causing shrinkage of the gums and loss of the teeth. In this case, I highly recommend laser surgery as soon as possible. If you leave it as is without treatment, you will lose all 4 teeth and will end up needing 4 implants.
You mean I don't have any other option, right?
Yes, I do.
Let's schedule the surgery as soon as possible then.
Of course. Now, I can schedule you in for next Wednesday, just 1 week from now. Until then, I'll prescribe appropriate medication so that the condition does not worsen. You should feel better soon.
Thank you. Thank you so much.
I promise I'll take care of these issues. Trust me. By the way, I heard from your wife about your current situation. It must be really tough for you, but you should try to relax more. Try to get as much rest as possible and make sure you exercise regularly. Getting enough sleep is also important. Maybe talking with your wife might help. Anyway, stress is the most harmful thing for your oral health and your overall health as well. Naomi, please help your husband find ways to lessen the stress in his life.
Yes, we will. Thank you.
They leave Dr. Kelly's office carrying a prescription. That night, when Dr. Kelly goes home and has dinner with her family, she suddenly thinks of Pastor Tim. She starts to wonder if there was anything she could do to help him. And after some Google searches, she finds something that might be helpful to him. A book titled From Stress to Stillness by Gina Lake. It's a book with chapter headings like how we create stress and how it affects the body, how to distress, tips for quickly moving into stillness. She places an order for the book to be delivered the next day.
Good morning, Pastor Tim. How are you feeling today?
I'm fine, doctor. How about you?
I'm fine, thank you. Is the medicine working for you?
Yes, it is. Thanks to the medicine, I slept well for the first time in a long time.
That's great. Well, last night I found a book that might help you, and I've already ordered it. As soon as I receive it, I'll send it to you at the church. I'm hoping it could be of help.
Thank you so much. I really appreciate your concern.
No problem. Your good health and happiness are my primary concern. Anytime you need help, please don't hesitate to contact me. I'm your friend and will always be on your side.
Thank you, doctor. You've already helped me a great deal, more than you know. This case study gives us a very important insight into how a dentist might treat their patients. When most dentists meet patients like Pastor Tim, they probably just provide treatment for the periodontitis. They may think that's all they could do. However, Dr. Kelly thought differently. She not only looked at Pastor Tim's oral problem, but also paid attention to what the underlying cause was. Her focus was on Pastor Tim as a whole person, so she could discover how to help him. In the end, Dr. Kelly, whose interest as a dentist was not limited to treating her patient's oral problems, was interested in the patient himself and found a way to help him in a more fundamental way. Patients who've been touched in such a way would not be able to remain unmoved. They would feel they too must convey kindness and goodwill to other people. From a dentist's point of view, would there be a better reward than that? Next time, I will discuss how the front desk can create the wow experience. Thank you so much for watching.